10 signs of psychiatric illness you should not ignore. Welcome back. This is Psych Talk. I'm Dr. Wendla, and we're going to talk about that right now. Can help. Here's a list of the 10 things you need to think about carefully, the 10 things you should never ignore. Number 1, dramatic changes in your sleep or appetite. If you find you are suddenly unable to sleep at night, particularly if you are waking up early in the morning and unable to fall back asleep, this could be a sign of depression or anxiety. If you find that you're falling asleep during the day or feeling excessively sleepy, this could also be a symptom of depression or anxiety or other psychiatric illness. A sustained loss of appetite can be a sign of a medical condition and should certainly be evaluated by your physician. If that is ruled out, it can be a sign of a psychiatric illness. Such psychiatric illnesses can include the following: depression, unresolved trauma, PTSD, complicated grief, and other things. Similarly, an unusual change in appetite in the other direction, so sudden craving for carbohydrates, an increased appetite, and a tendency to overeat that is uncharacteristic, can be indicative of either medical problems or psychiatric problems, including eating disorders and mood disorders. Number 2, withdrawal, isolation, and apathy. If you find yourself withdrawing from friends, social activities, and feeling uninterested in activities that used to bring you pleasure and joy, this is a serious sign of problems. It is particularly problematic if it persists for a significant period of time. According to the Diagnostic and Statistical Manual, if these symptoms persist more than 2 weeks, we really need to pay attention to them. Feelings of boredom and a preference for isolation over social interaction that is uncharacteristic for your personality is something to pay attention to. A feeling of irritability around friends and family members, and a persistent desire to push people away should be warning signs. Number 3 is the presence of an unstable mood, specifically extremes in terms of mood swings. The presence of something like this can indicate bipolar disorder, schizoaffective disorder, again, depression, and a variety of anxiety disorders. In addition, people who have personality disorders or substance abuse disorders might suffer from something like this. There are a variety of other psychiatric illnesses that can present with extremes in terms of mood swing. It is normal to have moods change throughout the day and over the course of several days. Human beings experience mood changes. The issue is really the extreme nature of the mood swing and the fact that when we're suffering with a psychiatric illness, the mood swings can cause us to be unable to cope with life. And finally, the mood swing often appears to be unrelated to anything happening outside of ourselves. Number 4, you are experiencing overwhelming anxiety, worry, and even panic. So if you're finding that most of the day and on most of the days, you are experiencing excessive worry going around and around in your head about things you cannot control, and it's even disrupting your sleep, and you've even found that the worry has escalated to the point of causing panic attacks or what people think of as anxiety attacks, this is a symptom of possible mental illness you cannot ignore. Excessive and overwhelming worry and anxiety can be a symptom of generalized anxiety disorder, panic disorder, agoraphobia, severe depression, bipolar disorder, obsessive compulsive disorder, PTSD, unresolved trauma, and other disorders. Sometimes people with unresolved trauma who are in denial of that trauma will experience other symptoms of anxiety like excessive and overwhelming worry. Number 5, feeling down or up almost all of the time. And this is technically defined as a persistently depressed or persistently elevated mood most of the days, almost all of the day, for a period of more than 2 weeks. For children and teenagers, this would be defined as a similar period of elevated or depressed mood, but only lasting a period of 1 week or longer. As I said earlier, a waxing and waning of the mood and changing the mood is normal for human beings, but a persistently, significantly elevated euphoric mood or depressed mood for a sustained period of time is atypical, and we need to pay attention to that. Number 6, substance abuse. Oftentimes, when people suffer from a mental illness, they will use substance abuse, drugs or alcohol, to medicate the symptoms. Approximately 50% of people affected by severe mental illness are also affected by substance abuse. 37% of alcohol abusers and 53% of drug abusers also have a significant mental health or mental illness diagnosis. So if you find yourself abusing alcohol and or drugs, there is a high likelihood that you also suffer from a significant mental illness. And this symptom, substance abuse, should also be paid attention to. Number 7, an inability to cope with life and or impaired cognitive function. So an inability to cope with life is a sense of just chronic overwhelm. So I can't do it. I can't handle school. I can't handle work. I can't handle my home life, being a parent, grocery shopping, going to the post office, just general life, a feeling of being chronically overwhelmed and it's just too much. Oftentimes, this is combined with a sense of what a lot of people think of as brain fog. And in psychiatry and psychology, we call impaired cognitive function. There are a lot of psychiatric illnesses, mental illnesses that cause a impaired cognitive function, lack of concentration, memory disturbance, those kinds of things. And this can actually be tested and shown to be the case. And so people will constantly forget things and lose things and not have what they need to get a certain job done, particularly at school or at work. And it causes a tremendous amount of frustration and a sense of overwhelm. So if you find yourself feeling particularly an increasing sense of inability to cope with daily life, this is something that we really want to pay attention to. Number 8, psychotic symptoms. Psychosis itself is not a diagnosis, it's a symptom. And psychosis is, in essence, a break with reality. There are a lot of different psychotic symptoms. I will go into them in another video, but the most common psychotic symptoms are hallucinations and delusions and a breakdown in thinking. Specifically, hallucinations can be visual and they can be auditory. So you can hear things that are not there. You can see things that are not there. Delusions can include things like believing things that are not true. So a delusion is a fixed false belief. The presence of hallucinations or delusions is a very serious indicator for the potential of a psychiatric illness. The illnesses that are included in a differential diagnosis when someone presents with psychotic symptoms can include things like schizoaffective disorder, schizophrenia, psychotic depression, postpartum psychosis, bipolar disorder, substance abuse, severe trauma and dissociative disorder, and other things as well. There are also a variety of non-psychiatric illnesses that can cause psychotic symptoms, and those have to be explored. Psychosis is not uncommon. It is estimated that about 100,000 people in the United States every year experience psychosis. And about 3% of the population will experience psychosis at some point in their lifetimes. So again, it's not uncommon, and it's a symptom that absolutely needs to be paid attention to. Number 9, you're experiencing episodes of extreme anger out of proportion to the triggering event, or episodes of violence. Unfortunately, several psychiatric illnesses can result in violent behavior. Of course, lots of people engage in violent behavior and do not suffer from psychiatric illness. And lots of people, most people with psychiatric illness, are not violent. But if you are experiencing extreme anger, and particularly anger that results in violence, this is a symptom that we cannot ignore. Sometimes people who are experiencing extreme mood swings, extreme depression, bipolar disorder, manic episodes, paranoia, psychotic symptoms, problems with substance abuse, or have been traumatized in some way, may have difficulty controlling their impulses. And sometimes this results in violent behavior. If any of these things are true, please do seek professional help. And the last sign of a possible psychiatric illness that you cannot ignore is thoughts of self-harm or suicide. Rates of suicide are up over 35% since 1999. And it is estimated that at least 90% of all people who complete suicide have suffered from some form of mental illness. Please note that the phone number and text information for the National Suicide Prevention Lifeline are in the links below this video and also scrolling as I'm talking right now. If you are triggered by this video, or if you are feeling any of these feelings I'm discussing, please call 911 or go to the emergency room nearest you. Help is available and close by. So if you or someone you love is having thoughts of suicide or actively engaging or thinking about engaging in any form of self-harm, please get help right away. Okay, so what have we learned? I'm going to go back through these quickly. The 10 signs of mental illness we don't want to ignore. Number 1, a dramatic change in appetite or sleep. Number 2, withdrawal, isolation, apathy, loss of interest in activities we used to enjoy. Number 3, unstable moods and extreme mood swings. Number 4, overwhelming anxiety, worry, and panic. Number 5, feeling either up or down most of the time. Number 6, substance abuse. Number 7, an inability to cope or brain fog. Number 8, psychotic symptoms. Number 9, or extreme anger and possibly violence. And 10, thoughts of self-harm and suicide. So that's it for today. Thank you for listening. This is Hi guys, I'm Dr. Wenla. This is Psych Talk. Thanks again for listening. Just a quick note to say if you like this video, please like and subscribe. Also, check out my journal and community and see if you're interested in signing up. I appreciate you listening. Check out the links below for additional videos you might be interested in. See you next time.